Hello, everyone. I see Tom and Cindy, Tom Burton and Cindy Starnes from the FAA, two of our biggest CFC champions. So thank you all for joining us. Thumbs up from Cindy and Tom. I love it. Awesome. Well, I'm Bailey Gordon. I'm the zone manager for Oklahoma and North Texas. We'll wait just another second or two before we really get started to see if we have a few more federal employees log on. If you all wouldn't mind muting yourselves when you're not speaking so that we can make sure that we don't have any feedback or background noise. So we can put our full attention on each of these wonderful charities that's joined us. So I think that's really our only ground rule for today, our only housekeeping item. So thank you everybody for joining. We are recording this session so that anyone who's not able to join us live can see it later. So again, thank you all for coming, especially to all of our charities for taking time out of your day to share your stories with us. So I know that we've already had a really impactful charity fair last week for Oklahoma and North Texas, and I'm sure that your stories will be just as inspiring today. So I think let's go ahead and get started. As a lot of you know, the campaign closes this Saturday, January 14th. So now is the time to get those pledges in, whether it's a paper pledge form or if you go through givecfc.org, use your login. Givecfc.org is the easiest and best way to give, just because you can use the online search to search for all of the charities that are available to give to through the CFC. You can search by cause, you can search by charity name, you can search by state, city, you name it. So like I said, we have just a sampling of some of the really incredible charities doing great work on with us today. We're excited to hear from, and there are so many more where they came from. There's so many more charities that you could give to for really any cause. So without further ado, I think let's go ahead. The charities are definitely more exciting than I am. So let's go ahead and get started. So we're going to start by hearing from Janine Yanish Jones from the Health Alliance for the Uninsured. So Janine, I will let you take it away.
Good morning, and thank you, Bailey, and I appreciate getting to be a part of this presentation. And more importantly, with Health Alliance for the Uninsured, we're really grateful to be a combined federal campaign participant. So thank you so much for including us, and thank you for taking a couple minutes to hear about what we do and how you can be a part of it and make a difference. I'm going to pull a slide up here quick. Here we go. And we have 5 main focus areas at Health Alliance for the Uninsured. Through the United Way of Central Oklahoma, our 2 main programs that are our flagship programs, which is our Care Connection program, which provides specialty care referrals, and our prescription assistance program, which provides millions of dollars of medication to uninsured individuals in Oklahoma. The way our program works is that we partner with the free and charitable clinics. So we are an umbrella organization unique to any organization in the country, actually, that does this. We were founded under Dr. Murrow Krishna when he was the head of the Oklahoma County Medical Society, and he saw that we needed more access to care for the uninsured for a variety of reasons. This benefits the state and individuals in multiple ways, to have your health, to have quality of life, to be able to be employable, to be able to participate in activities with your families, to have, and you can see in Oklahoma, as we know, most of us know, we have really poor health outcomes, and our organization is really working hard to try to improve the health outcomes in our state. Because the individuals that we serve disproportionately are the ones that have some of the worst health outcomes because they're more vulnerable. They have less access to health care. They're not doing preventative care. or even managing chronic health conditions where they may end up in the emergency room because they haven't been taking their insulin as prescribed or their heart medication because they're maybe in a poverty mindset where they're trying to save that medication. Maybe they're sharing it. Maybe they're not, they don't know where they can go to get that medication. So we really have an opportunity to be a life-saving organization. We also have a major challenge coming this year nationally, where the public health emergency is expiring, and this will be affecting millions of people who will be being rolled off of Medicaid because they've been held on because their income, even though their income had disqualified them because of the public health emergency, they've been able to keep their state insurances. Well, with the public health emergency expiring, we have more than 275,000 Oklahomans who will be losing health insurance in April. So we're trying to be a part of that solution and proactively with our navigation team gearing up to help connect individuals to more free clinics. So we're excited to be a part of the solution. We're devastated that this is where we're at because we already have almost 500,000 uninsured in Oklahoma, and this really increases that number. So it really is a dire situation, but we're fortunate to have the opportunity to be a part of the solution through the specialty care we give, through the prescription assistance, by navigating, connecting people to a closed loop referral, making sure that they get connected to that resource, whether we're using the Unitas platform or a direct call or whatever's going to work the best to get an individual, and then following back with that individual, making sure that they have gotten connected to that care. And we're at about a 75% success rate right now in that program. So we're thrilled. And then we also have a program that we work with clinics and individuals statewide to help with diabetic interventions, including mental health, behavioral health services, and screenings. And then the fifth thing that we do that is a huge part of getting to be a part of the United Way community, or the combined federal campaign, is that we provide resources to the free and charitable clinics beyond just these specific things. So for example, we have doctors' offices closing and they want to donate supplies to the clinics, or we needed to be able to provide personal protective equipment during the pandemic, flu shots, their testing, vaccines, all the things. So we have that really great safety net that we can provide to our safety net partners. So we're thrilled to be in this space, but we can't do it without your help. So thank you so much. Thank you, Bailey and the team, for inviting us to be a part of this. And we just can't thank you enough for all that you do.
Thank you for all you do, Janine. And I will say, I still have not gotten over the Halloween tour that you all gave about how scary it is when you are uninsured. So I know you certainly left a mark that day, in my mind especially. But thank you for sharing and for all that you all are doing to help change those health outcomes here in Oklahoma.
Thank you, Bailey.
Yeah. All right, well, next up, we are going to move to learning about needs in the animal welfare space. So I would like to welcome Candace Beatty from the Pet Food Pantry of Oklahoma City.
Thank you for having us today. I'm excited to talk to you guys about pet food and how the impact of it is made throughout the community, as well as how you guys can help with us. So I'm going to share this slide. Oh, okay, there we go. So we are Pet Food Pantry of Oklahoma. We provide free pet food supplies to low-income seniors, veterans, disabled, and homeless communities. By that, I mean we deliver it literally to their doorsteps every month for the amount of pets that they have. And then we also have a secondary program that we started at the beginning of COVID, where we saw in the community that people they struggle to make ends meet as is. COVID definitely threw a curveball out there with making that worse. So we started going out into the community a couple times a week and just giving out to anybody in need. No requirements, you just have to come meet us. And then we also partner with other agencies so that we can make sure that we are reaching people where they are. So we see the struggle, especially with our people who are in home, the seniors, the disabled, they tend to, their pet is their family. So they tend to give up their own needs for their pet's needs. That means that some of these people are going without their utilities, they're going without their medications, they're foregoing their food so that they can make sure their pet is taken care of. So when we go out into the community, we try to partner with food pantries. We find ones that are like mobile food pantries. That way they can get human food for them, let us take care of the pet food. We also started partnering with Meals on Wheels for that same purpose. These seniors are getting one meal delivered a day, and usually they're splitting it in half and giving half of it or more to their pets instead of eating it for themselves. So these pictures here, these are some of our clients you can see, and just how much they love their pets. Even there on the right is a homeless dog, and you see like his person has the dog covered up in that blanket instead of himself. They really, everybody who owns a pet, I'm sure you guys can relate, they love their pets. So we pulled a few statistics. These aren't updated because they haven't, this US Census hasn't updated since I pulled these, but this is showing like how many people own dogs, how many people own cats. You can see the impact that the majority of people have a pet. And then you can also see, at least here in Central Oklahoma, which is our primary focus, how many people qualify for our programs. So the impact that we're making, there is so much more we could be doing, so many more people who need the assistance than the ones that we are able to reach. And that's just a matter of resource. That's where you guys can come in. We are always looking for volunteers. So people who can help deliver the food, people who can help sort the food, who will pick up donations for us and bring back to our facility, repackaging. There's a lot of volunteer opportunities to help us reach more people. And then here's a few statistics too, showing you, like right now we've got about 400 clients that we deliver to their homes every month just here in Central Oklahoma. And then I've listed some of our local food pantries. Like I mentioned, a lot of people who struggle with human food also struggle with pet food. So we have found putting food into these food banks allows, again, all the needs to be met. And then you guys can see, if you look at the numbers at the bottom, the impact that we're making on a monthly basis. I mean, back in 2019, we were feeding about 500 pets a month, which is amazing. But just this last year, we're up to 2150 a month. Now, some months are going to be higher than others. It's just the way the economy goes. But on average, that's how many pets we're able to feed right now. We also have started working with shelters and rescues throughout the state because the need is so much bigger than just here in Oklahoma City, but we don't have the manpower to reach the whole state. So we've learned that reaching out to rescues and shelters and giving them food and then letting them disperse through the communities helps not just Oklahoma City, but helps the state as a whole. So thank you guys for letting me share these numbers with you and showing you the impact that CFC has helped us achieve, as well as the volunteer opportunities. If anyone wants to come and volunteer with us, please do. Thank you so much for having us.
Wow, thank you for sharing that. I cannot believe how much the need has grown and how much more you all are giving over just the last couple of years. So I also didn't realize all the partnerships that you had and how you're helping those seniors with mobile meals or Meals on Wheels, excuse me, to make sure that they're not just sharing their food with their pets, so everybody's getting fed. So thank you for the work that you're doing. I know we all love our pets, so that is that's so important. So wow, I just learned so much every time we get on one of these. All right, up next, we are going to go to Tulsa to hear from Mike Lager with the Tulsa Area United Way. So Mike, it's over to you.
Hello. First of all, thank you so much, CFC, for helping host this event and get us connected with those individuals in the federal community who want to participate in their charities. CFC code 74397, Tulsa Area United Way. A lot of people wonder why donate to the United Way, which is a great question. Our United Way specifically serves 59 local nonprofits throughout the area. That area is just not Tulsa. It's actually the 6 surrounding counties, including Tulsa. So if you have friends or relatives who've made use of the social services programs within the Tulsa, Creek, Rogers, Okmulgee, Osage or Wagner County area, they may have been touched by one of the 59 partner agencies that we help support. That being said, I would really I think I would be amiss not to share one of our videos from an individual in those local rural communities that we're serving. So I just have a little short snippet from her that I would like to share. Do we see that video up now? Is the video on the screen?
Yes.
Perfect.
In Bristow, the United Way partners with Bristow Social Services. Executive Director Tony Godwin and her staff of 2 employees worked countless hours during the pandemic to make sure residents receive food, clothing, prescriptions, and help with monthly bills.
Last year alone, we were able to assist well over 13,000 individuals with the basic needs assistance. So Bristol Social Services serves as a hub to the rural community.
Their efforts included taking groceries to Elma's front door. Elma was facing more than just pandemic challenges. Battling cancer for the 2nd time, she could barely afford to pay for food.
I really don't know what I've done without them. I think everyone, the people that delivered the food, the people that donated to United Way, the services here, all of it took people helping people. And that's what it's all about, is just do what you can.
When you donate to Tulsa Area United
So
Way,
if it weren't
know that
for,
your
oh, sorry about that,
volunteers
guys.
spend more than 5,000 hours analyzing the finances.
So if it weren't for individuals like you, people like Alma, who we just learned about, may not have access to certain resources within their community that are offered through our 59 agencies. When you make a donation to the United Way, do know that the organizations that we work through and with actually are subjected to a 170-person volunteer community investment team. Those volunteers go through and reassure that the financial statements that we're receiving are accurate, that they're maintaining policies of non-discriminations, and actually interviewing people like Elma to ensure that what we're being told is going on is actually happening. So you're not just throwing a gift of money at something that you will hope will benefit the local community. We're actually ensuring that it's happening by being boots on the ground. We can never be thankful enough to individual donors like you. As a matter of fact, 55% of what we receive in donations every year come from individual donors. So yes, we are very fortunate to work with large organizations, but if it weren't for folks like you, 50% of the programming that we offer through these organizations may not be funded. So thank you for considering donating to the United Way. Thank you for participating in CFC. And again, thank you so much, Bailey, for inviting us.
Yeah, of course. We really appreciate you being on today and sharing. Your impact is huge. And like you said, I know that a lot of people know that a lot of corporate donors are there, but we really rely, all of the charities really rely on these individual donations. And through CFC, you can make a really big impact when we all get together. So thank you so much for sharing, Mike.
Thank you.
All right, next we are going to learn a little bit about D-DENT. So Laura Gutierrez is here to share with us. So Laura, I will turn it over to you. Laura, you are still muted. There you go.
Hi, my name is Laura from D-DENT. Thank you for allowing us to be here today. We're so grateful that you give to CFC. CFC funding is so important to our organization to help fill those gaps that other restricted funding does not cover for us. Here at D-DENT, our mission is to help improve the oral health of Oklahomans in need by providing preventative dental education and free comprehensive dental care through a statewide network of volunteer dental professionals. Assistance is provided for seniors, developmentally disabled persons, and veterans who are low income and uninsured. I'm going to show a video of one of our veterans, her name is Samantha, and she benefited from our restorative program here at D-DENT. Can you guys see the screen?
Yeah.
Okay.
Prior to D-DENT being able to help me, I was unable to afford services and help from anywhere else. The medications I had to take were destroying my teeth and my bones. I had to find somebody who was willing to take me on as a patient. One of the last patients I treated was very quiet, and then when we finally treated her, she just had tears of joy. The most rewarding part about the program was the finished product and my smile at the end.
So that's just a brief video of someone who benefited from our program. Our program provides free comprehensive dental care from dental professionals in private clinics to achieve full mouth restorations. This can include exams, cleanings, fillings, extractions, dentures, partials, crowns, and root canals. D-DENT is a statewide organization, so we reach everyone throughout the state of Oklahoma. We also have a free oral health education program and oral cancer screening program. These programs provide behavioral interventions to seniors and disabled adults. These services are provided by our on-staff dental hygienist. This program is also statewide, but they actually go into places like senior centers and veteran centers and anywhere that provides services to developmentally disabled individuals in Oklahoma to provide these services at free of charge. We also have a lot of volunteer opportunities for dental professionals. For those who are not dental professionals, we also have volunteer opportunities. Dental professionals can volunteer directly in their own clinic or volunteer to provide dental care to our patients through community clinics that we host throughout the year to allow those professionals who are not able to volunteer in their office an opportunity to give back as well. Additionally, we have volunteer opportunities to help our oral health education program, and you don't have to be a dental professional to help with that program. So we are so glad that you guys invited us here today. I want to encourage everyone to give to the CFC. The funding that this provides to local organizations like us allow us to continue our mission to help those in need. You are so important and vital to our missions. Thank you.
Thank you, Laura. Thank you so much for all the work you do to make sure that everyone receives the dental care they need. All right, we are moving right along today. Thank you. We've already heard so many incredible stories from each of these awesome charities. So next, I'm happy to introduce Molly Swafford, who is with the Bridge CAC.
I think I may be the only representative Texan here today so far.
There you go. Well, we've got to have some Texas charities on too.
Yes. So I just wanted to start this morning, obviously, by saying thank you for the opportunity. But more importantly, I just wanted to share a quick story. Because of the nature of the work that we do, I like to share just a persona, an example of what our donors are providing for Panhandle kids when they make a gift to the Bridge Children's Advocacy Center. So Bella is 7 years old, and her teacher went through a training that was provided by the Bridge, where the teacher learned how to recognize the signs of child abuse, respond appropriately, and how to report them. And Bella was also in class when the outreach specialist from the Bridge came to do Play It Safe, which is a talk about body safety that's age appropriate and helping kids to understand when it's okay to keep a secret and when it's certainly not okay to keep a secret, and what appropriate touch is and those types of things. And so after that training, Bella went to her teacher and made an outcry that something had been happening to her when she went to her uncle's house on the weekends, and she wanted that to stop. And so because the teacher had been through the training, she was able to make the appropriate call to Child Protective Services, who then initiated a call to law enforcement. And because this was an emergency, this child might be going back into that home over that next weekend, and an emergency Bridge appointment was made. Bella came with her mom. Her mom wasn't really sure what was happening. But when she got here, she walked into a very warm atmosphere. Bella started watching a movie. Her mom met with one of the forensic interviewers to find out why they were there. A family advocate was present to answer questions as well as to help with paperwork. And then eventually Bella was taken into one of the interview rooms where she was just asked to share her story in a way that was non-leading and non-pressure. And that story was videotaped. It was also monitored by a multidisciplinary team across the hall. That team is made up of law enforcement, child protective services, and other agencies who might need to be a part of that case. And then that's entered into evidence. And during that interview, things that came out, that information was then shared with family advocates so that they could make the right referrals to help Bella on her road to healing, as well as the rest of the family. Bella also needed to have a sexual assault exam because of what came out of that interview, but that was able to happen here at the bridge. She didn't have to go to an emergency room, which might be scary, because the same nurses from Northwest Texas Hospital come to the bridge and are able to do those exams here as well. All of this process is going to get Bella onto the path of healing, and it's going to get her justice. A full team of people called a multidisciplinary team meet in a case review to make sure that all of the pieces of the puzzle are being put together for that case on Bella's behalf, and that she's being protected and that she will have justice. That's what donors are providing when they make a gift to the Bridge Children's Advocacy Center. I'm going to do my best to share the right thing here. I never know if I'm doing it right. Can you see my screen? Okay, perfect. So make sure, there we go. So our headquarters are in Amarillo, Texas. We do serve the upper 26 counties of the Panhandle of Texas. So we have the largest geographical area of any CAC in the state of Texas. And so our donors are helping a lot of kids. We also have satellite offices in Hereford, Clarendon, Dumas, and Pampa so that we can go to those families rather than them having to come to us. We opened our doors in 1989 as the first CAC in the state of Texas. And I've just sort of shared to you through Bella's eyes what she experienced, what you're providing for children who have either been a victim of abuse or have witnessed a felony. When they share their story with our specially trained forensic interviewers, they are basically creating a video affidavit that is age appropriate. The questions are asked in a non-leading way, and it keeps the child from being feeling like they are being interrogated. So they don't have to share that story over and over again and be re-traumatized. As I said, we do physical exams here as well. And we make those mental health referrals and other advocacy options for families that are so important for them to be able to heal. The prevention part of what is being provided by our donors is incredibly important because education is what is going to help us to stop child abuse. Kids need to know what child abuse looks like, what's normal is or may not be normal. If you're growing up in that environment, you may not think that there's anything different about it. And so allowing kids to understand what is and is not child abuse is really important. It's also important that professionals who are working with kids understand those signs of abuse, and also that the professionals like law enforcement and child protective services know how to respond appropriately. This is particularly important in our rural counties. While we serve 26 counties and our offices are located in Amarillo, which is Potter and Randall County, 48% of the kids that we saw in 2021 came from those rural counties outside of Amarillo and Canyon. So I hope that our federal employees know, no matter where they're located in those 26 counties, they are helping children from all over the Panhandle. This graphic basically just shows what happened to a kid when they made an outcry before the CAC. there is so much to navigate between law enforcement and justice and getting health referrals and all of those things. With the CAC, we put the child and the family at the center, and we bring all of those resources to that child and family so that they are not having to navigate all of that on their own, on top of going through an incredibly challenging and hard time for their family. So we are CFC number 73052, and our children do need your support. I want you to know that in 2022, federal employees provided enough funding to help 2 children, which is wonderful. I also want you to know that in 2021, we saw a 40% increase in the number of children that we're serving. The pandemic has not been kind to kids. So we saw 1,557 children in 2021. And so we are a 501c3 nonprofit, even though we are fulfilling a role that is mandated by state and family law. In order for us to remain neutral, we have to depend on donations that come from our community. And so this coming year, $1,128 will provide all of those services I spoke about for 1 child. And so whenever you get ready to fill out your form, if you want to sign up to do $94 a month, that will provide services for 1 child. And it would be incredible if you would consider doing that. Our donors know that they can trust us, that we are providing the services that we say that we are. We do have volunteer opportunities. If you're in the Panhandle area, we'd love to have you assist with our annual gala. We need folks to sort in-kind donations. We give every kid a comfort item when they come through the agency. And so that's a stuffed animal or a blanket. We need help with sorting those. And you could also host an in-kind donation drive for those as well. Mostly though, I just want you to know that we are so grateful for the impact that you are making for Panhandle kids by participating in the combined federal campaign. Again, we are the Bridge Children's Advocacy Center, CFC number 73052, if you would like to participate and help our kids. Thank you so much.
Thank you, Molly. I believe Debbie said it best, that those are just heartbreaking statistics. So thank you for sharing that with us, for sharing about the need, and also for breaking it down for how we can help to serve each of those kids. So thanks, Molly, for joining us. All right, next we are going to hear about the Salvation Army of Central Oklahoma, and Annie Wellborn is here to tell us more about their organization.
Hi, everyone. Good morning. I'm so excited to be here today on behalf of the Salvation Army and get to share with you a little bit about what we do locally. I know that the Salvation Army is an organization that we've probably all heard of. The Salvation Army has been around since 1865, was started in London, England, and is now across the world in over 133 different countries. But today I'm really excited to share about our local programming here in Central Oklahoma, specifically serving 5 counties in the OKC Metro, including Oklahoma County, Cleveland County, Canadian, Logan, and McLean counties. And so my favorite thing to do is to allow people to come see our site located in Oklahoma City. But since I can't take you on a real tour today, I thought I'd sort of walk through some of our different programs that we have throughout our service area. So to begin, we have a client choice food pantry. This is a really wonderful spot for individuals to visit, because our main goal here is to provide dignity. And so instead of just handing them a pre-organized food box, we're really allowing each individual to walk through, select the items specific to their family's needs, and make sure that they're getting the adequate sustenance they need to, make healthy meals and provide well for their family. Throughout our virtual little tour, I'll point out some different volunteer opportunities as well. If you are local to the area, this is a great one, because we love to be able to have volunteers walk with them, push their carts for them, and help them as they're shopping. Along with this, we also have our Red Shield Diner, which provides a nightly community meal. We serve anywhere from 150 to 200 people every single night of the week. And so we're inviting anyone from the community in for this meal, starting with the guests staying in our on-site shelter to just anyone who's in need of a safe space to eat. And so we love whenever groups or organizations stop by maybe to make a meal or help serve it, or hey, even if you just want to order pizza, we love that too. And so that happens every single night at our facility. Along with that, you may know that the Salvation Army is called upon quite often in times of disaster. And so if you have a heart for serving in crisis times, we offer disaster training services, and we are deployed all across the country in times of need whenever we're called upon. And so it's a really unique way to serve people during the worst times of their life, and it makes an impact every single time. Additionally, we have an on-site shelter serving over 109 individuals each night. And so this is a really wonderful opportunity for individuals to have not only a safe space to rest their head, but also game plan what their next steps will be as they exit homelessness. So we actually have specialized case managers focused on residential services and pinpointing not only their current area and assessing where they are at this point in their life, but also working with them to establish a game plan to help them reach their goals and establish their next best steps. In addition to our residential case managers, we also have a case management team that focuses on general social services. We provide emergency financial assistance to those in our community in need. So if they are having trouble making ends meet, paying bills, keeping the lights on, we want to make sure that they're met wherever they are. And so we have a team specialized to meet with individuals and not only just hand money out, but also track their progress and work with them and evaluate not only how they're doing financially, how their job searches are going, but also how their mental health is doing. Also, just keeping tabs on them to make sure that they have hope maintained throughout this process. Another wonderful program that we have is our Night Watch program, because we recognize that not everyone can make it to our facility each day. And so we have a team that goes out every Thursday night and provides meals, essential items like blankets, hand warmers, and also just words of encouragement. The Salvation Army always wants to make sure that we're doing the most we can to encourage those in our community and uplift them. And sometimes they just need someone to look them in the face and say, I see you and I care about you. And so we want to be sure that we're meeting individuals where they're at. The Salvation Army of Central Oklahoma also hosts a Boys and Girls Club in Southeast Oklahoma City. This is such a fun place to be. It's always my favorite days whenever I get to go visit them and hang out with the kids. It's a great volunteer opportunity too for your group. If your group soft spots are kids, they have so many wonderful ways you can get involved, whether it's educating them on your career path or doing fun after school activities with them. We love to have different groups be involved, but we work out of school hours. And so just making sure that kids have a safe space to do their homework, learn and grow within a safe environment. Additionally, we also want to provide for seniors in our area. We currently run 3 different senior centers. And so if you are know of anyone in need that is looking for a space to have community and a lunch meal provided every day. That is something we have across the metro, our different sites. Again, super fun to get involved with as a group. They love bingo nights, and I'm involved in their book club, and it's always a good time. We also have some seasonal programs that we run. One is our fan drive over the summer. We'll be kicking that off soon. And so we just want to make sure that everyone has adequate cooling in their homes, especially during the Oklahoma summers. It's just not nice to us. And so we just want to make sure that everyone is cared for. And then in the winter, we just finished up our favorite time of the year, which is our Angel Tree program. And so during that time, we're providing Christmas gifts to those in needs. It is a months-long process. And so it's really wonderful to finally get to the end and see the reward of the families picking up all the presents that are going to be wrapped and put under the tree for Christmas. And so that was such a fulfilling season to just finish up. And if you know the Salvation Army for one thing, it's probably our bell ringing. And so if you're ever wanting to get involved, feel free to reach out to us, because this is something that we start preparing for now, even though we just finished up. And so this provides a large portion of our funding throughout the year and impacts all of our programs, similar to how CFC funding does as well. And so we are always just so grateful for anyone who participates, because it helps support all the programs you've just seen. We're just so grateful for everyone who volunteers and provides financial support for the Salvation Army, because we truly couldn't do our programs without your help.
Wow, thank you. You all stay busy throughout the year. So thank you, Annie, for sharing all the many, many ways that the Salvation Army is working. All right, next up, we are going to hear from Betty Martin from Murrow Indian Children's Home. So Betty, are you ready to share? All right, just there you go.
Okay, I'm sorry. Yes, I am ready now. Thank you. First of all, I would like to say thank you to the federal employees for donating to the combined federal campaign. There are a lot of amazing programs out there that are providing services to the community that they would not be able to without the funding from the CFC. So anyway, thank you for that. And also, I would like to say that thank you for allowing us to be part of the federal campaign, the combined federal campaign, because this is our first year. And so we are, we're new to this, but thank you, we appreciate it. My name is Betty Martin. I'm the executive director here at Murrow Indian Children's Home, and Julia Hasey is with me. She is the program manager for Murrow Indian Children's Home. Here at the home, we can house 24 underage children, and the children are placed here. They're children that are in tribal custody, and they're placed here as a result of abuse and neglect. They can live here until they age out, and at that time they move over to the transition program, and we can only house 6 youth in that house because we only have 6 bedrooms. The mission of Murrow is to provide a safe, nurturing environment, spiritual foundation, and cultural experience to Native American children in crisis. There are several volunteer opportunities here with us. We have folks that do consumable supply drives, because I'm sure that a lot of these programs and a lot of people realize that whenever you are providing services, you go through a lot of consumable supplies. So that's one thing that is really nice. Also, we get volunteers to provide cultural activities for the children as well. Things like making ribbon skirts or doing beadwork, making stickball sticks, those kinds of things. But we've had a lot of non-native people that have come and just taught the girls how to do things like sew. And they've done things like rearrange our storage areas. We have a library. We've had a lot of folks donate books to the library, because one of the things that we have seen is that when most of the children come here, they're academically behind, and a lot of things they struggle with is reading. And so we have developed a library for those children. And also, For all of those of you that are a little more adventurous, we always have minor maintenance projects and like changing out a water faucet or spackling a door, lawn work. So we also have those kind of things. Right now, I would like to have our program manager talk about our transition program, because that is something that we are really proud of.
Okay, so the goal of the transition program is a little different than the minor children we have in custody. The goal of that program is to help the youth who are aging out of tribal foster care. So it tends to hit the range of about the 18 to 22-year-olds. And basically it's to help them develop life skills and prepare them emotionally to live independently. This program works to help nurture lifelong connections, empower them to continue their education, and helps them develop good coping skills and decision-making skills. They learn life skills such as cooking, budgeting, vehicle maintenance, home maintenance. The transition program became crucial here because we saw that kids who were aging out of foster care, but specifically tribal foster care for us, were leaving at 18 and going back into their communities. And they did not have adequate support, either emotional, family support, financial support. In some cases, these kids still were in high school. So they were leaving and not completing high school. So the shift became when we started encouraging kids who were aging out of tribal foster care and they can request to voluntarily stay in custody, which is an option until they graduate high school. So we're stressing that more now, that they sign back into custody until they complete high school. And for those who have completed high school, to go ahead and stay at Murrow or invite them to participate in this program at Murrow so that they can receive continued support, learn adult life skills, further their education, learn a trade, and maintain employment in order to save that money and transition into their own residence at that point. Our program assists them in doing this by providing safe and stable housing, establishing those permanent connections, receiving education assistance, employment assistance, and support for their social and emotional well-being. Currently, some of our adults, we have young adults, I say young adults, they are those 18-year-olds that were able to stay here and complete high school. So they're finishing high school, and one of those is also in trade school. The others that have graduated high school are all employed, and most of them have vehicles, have acquired their own vehicles. One of ours is actually employed at our local county jail, one that's had long-term employment at Lowe's. So what we've seen is that this has proven to be a necessary program because these were kids who grew up in the system for any number of years. That family support is not there when they leave. So the program's necessary to, in their lives, to break the cycle that they've seen to reduce the risk of homelessness, drug and alcohol abuse, poverty, and incarceration. So again, I do thank you for participating in the combined federal campaign and all of the assistant community support it gives. And I just want to mention our CFC code is 74650.
Thank you.
Thank you all so much for sharing that important work that you're doing. Wow, the amazing things that these kids are able to accomplish and transition into with your help. That's incredible. All right, now, last but not least, we've got our final charity speaker. We're going to be hearing from Carrie Simons with the Center of Family Love. So Carrie, will you please unmute and join us?
You bet. Can everyone hear me? Unmuting
Yes.
is the first technical challenge I've faced here today, so I'm sure I'll have more with my slides. But just thank you all for having us here. Thank CFC. A little bit about the Center of Family Love. We serve individuals with intellectual disabilities, and we do that through Christ. And I'm the Director of Philanthropy here at the center. And if you ever are having a bad day, come out to the center and you will be surrounded by one of our 130 residents, and they never have a bad day. Our residents, our heroes, is what we call them, will definitely make your day brighter. But we call them heroes. We call our residents heroes, and that's really because the courage that they have for making their achievements that they do each day, and they're just noble qualities. And so our residents conquer a lot with their disabilities each and every day. And when we see them do that, they are heroes to us. And that's a little bit about them brightening our day. But I want to share with you a story a little bit about how we got started. In late 1970s, the Knights of Columbus, several of the men of that council themselves had children with intellectual disabilities, and they wanted something better for their children. They started a grassroots effort in the state, and through that, they raised $1.5 million to start the Center of Family Love. And we're here in Okarche, Oklahoma. It's not the middle of nowhere, but it is out from Oklahoma City. But the center here, we service 130 residents. And these heroes' families have never been asked to pay for the care that they receive here. So you may be familiar or may not, but the old system for caring for people with intellectual disabilities was to put them in state institutions where they were not really able to have development of their abilities. The people were not even really cared about what are their abilities, what are their hidden talents, and really just were put there to kind of rest out the rest of their lives. Here at the center, we take folks from 18 up to the end of their lives. Some of our oldest residents are, a couple of them are in their 90s. But let me just fast forward now since the 70s to where we are at today and the discoveries that we're making. In 2022, you may not be aware of this, but more children are going to be diagnosed with intellectual disabilities than cancer, diabetes, and AIDS combined. So with community support like CFC and other entities, people with varying disabilities can live a fulfilling life and contribute significantly to our society. I'm just going to show, here's another technical piece that will be a struggle. Can you all see that? I should probably hit share first.
There you go.
All right, let me get it moved over here. Too many things going on. How's that? Can you all see that?
Perfect.
All right. I'm going to share here. This is Travis, one of our residents, and Travis is an unbelievable illustrator. He has illustrated a big portion of the Bible, but he just has a brilliant mind to sit and look at things and then picture it and not even have the picture in front of him and can draw from that. So we've been able to partner with some illustrator and book writers to be able to maybe publish his works or to have him be a teacher to others as he moves forward. This is Linda here, and she's working with one of our partners as we partner with 10 restaurants here in the Oklahoma City area. That's Cattleman's, and also this right here is Oklahoma City Golf and Country Club. But Linda was able to go through high school, even took a couple of years of tech school, and is now wanting to fulfill her pastry dreams. And then Shay here has an incredible ability to disconnect with animals. And we are partnering with the Oklahoma State University Vet School as there is an extreme shortage of vet techs to be able to welcome pets into a veterinarian's office and take care of them. And then another one here, this is Ashley, and she has a dream of being a dancer, but she wants to be able to teach people with intellectual disabilities how to do that. And so she's going to be the next generation hero for us, teaching other people with intellectual disabilities. So that's just some of the development that's taking place here at the center, and where the funds go is to help our residents see their dreams and see their future. Again, just wanted to thank you for being here. Bailey sharing, letting us share that. Each of you have also mentioned volunteer opportunities. So there's always an opportunity to come out to our facility. If you need a big hug, they will put it on your face, but they love seeing people out here and visiting with them. So CFC, thank you all. And Bailey, thank you for having us here.
Thank you so much. And I will volunteer to be a pastry taster. So yeah, these are some absolutely phenomenal things that your residents are accomplishing. Thank you so much. And I also just want to point out, I love how you all got started as a grassroots organization. It's amazing what a few families and people coming together can really do. So thank you for sharing with us. Like I said, this is that was our final speaker. So thank you to everyone for joining us. Thank you to all of our charities for coming on and sharing sharing everything that you do. The CFC, through the CFC, we have a huge opportunity to give and make a bigger collective impact than we would be able to do just on our own. So please visit givecfc.org to make your pledge today if you have not yet done so, or maybe if you've made your pledge, go in and make a few edits to include some of these phenomenal organizations. But yeah, you can always update your pledge right up until the 14th, which is this Saturday. So thank you all. Thanks to our federal employees for joining us. And I think that's it for me. So we'll be signing off, and we will see everyone tomorrow at 11 for our final charity fair of this year.